I'm your narrator reading for Carolina Pinzón, the bilingual dairy outreach specialist with the University of Wisconsin-Madison Division of Extension. In this video, we're going to talk about what mastitis is, its negative consequences, and how to identify it. Mastitis is a major challenge for dairy farms. It is the most common and most costly disease in dairy cows. Mastitis affects the health and welfare of cows because it causes discomfort and pain. It reduces milk production and milk quality, can cause permanent udder damage, affects reproduction, and in severe cases can even lead to death. Mastitis also affects the profitability of a dairy farm. It lowers production, lowers milk quality, increases treatment costs, leads to discarded milk, and requires more labor. Farms may end up selling more cows, which brings even greater economic losses. And of course, mastitis increases your workload, since you must spend more time treating and monitoring sick cows. When we understand how mastitis occurs, we can connect our daily work with the importance of prevention. Mastitis begins when bacteria and sometimes yeast, algae, or viruses enter the udder through the teat canal. Some harmful microorganisms live in the environment, like dirty bedding or manure-covered alleys. These are called environmental pathogens. Other microorganisms live inside the udders of cows that are already infected. These are called contagious pathogens because they spread from an infected cow to a healthy cow. When these microorganisms enter the udder, the cow's immune system fights back. It sends special defense cells, called somatic cells, from the blood to the udder. These cells eat harmful bacteria. This battle causes inflammation, heat, and pain, which are common signs of mastitis. However, if the immune response is weak, we don't always see visible signs. This is known as subclinical mastitis. In subclinical mastitis, the milk, udder, and cow all look normal, but the milk has a high somatic cell count, which tells us the cow is fighting an infection. High somatic cell counts reduce milk quality and milk price. So, how do we detect something we can't see? The only way to detect and monitor subclinical mastitis is by testing the somatic cell count. The most common tools are the California Mastitis Test, CMT, and the monthly milk test from the Dairy Herd Improvement Association, DHIA. In other cases, when the immune response is stronger, we see clear changes. This is called clinical mastitis. Clinical mastitis can be mild, moderate, or severe. In mild cases, the only change is in the milk, which may contain flakes, clots, or appear watery. In moderate cases, the milk may appear abnormal, and additionally, the udder can be swollen, hard, or warm. In severe cases, the cow appears ill. She may be depressed, feverish, dehydrated, off-feed, or weak. These cases are emergencies and must be reported immediately. Think like a detective when identifying mastitis. Use your eyes and your experience. When you forestrip and check the first streams of milk, look closely. Do you see flakes, clots, watery milk? If so, the cow is telling you something is wrong. That's a mild clinical case. Report it. When you inspect the udder, does it look swollen or red? Does it feel hot or firm? If yes, it is likely a moderate case. Report it. When you observe the cow's appearance and behavior, does you look sick, dehydrated, feverish without an appetite, or lethargic? It may be a serious or severe case of mastitis. It is an emergency. Report it immediately. Remember, you understand how and why mastitis occurs and how it affects cow health, milk quality, and farm profitability. Your work matters. Every day, ask yourself, what details can I focus on to prevent mastitis on this farm? Detecting clinical mastitis is your responsibility. Now you have the knowledge to identify whether a case is mild, moderate, or severe. Thank you for taking care of the cows and for always following the protocols on your farm.